Good morning. My name's Aaron. I'm a registered physiotherapist and I'm from InReach Online Physio. Today we're doing InReach Education Series number 5. We had a bit of a break over the summer and we're back this time to discuss the new World Health Organization's 2020 physical activity guidelines. This webinar is a little bit different. We're doing a recording and we're just posting it on YouTube. Before we had people attend the webinar and then we posted the recording after, but we're going to try something new. So I'm just going to minimize myself. Here we go. So a little bit about InReach before we begin. InReach is a fully virtual physiotherapy practice in British Columbia. We were established in 2018 with the goal of providing physiotherapy services to people in rural and remote areas and people who prefer not to leave the comfort of their home. We've built our team out and we have physiotherapists that specialize in neuro rehab, chronic pain, healthy aging, such as osteoarthritis, osteoporosis, physios specializing with pelvic health conditions, hands and arms, and cardiorespiratory disorders and disease. A little bit more about me. I was born and raised in Vancouver, British Columbia. Love all sports, specifically mountain biking, which I started when I was 14. I began racing when I was 16. I'm currently continuing to race as well as I work as a physiotherapist for professional, national, and World Cup level teams. I was a personal trainer and am a personal trainer and strength coach as well since the age of 19. And I went to UBC for my master's of physical therapy in 2016, more with the idea to learn how to better assess and treat people's injuries, having questions when I was a strength coach of what was going on with people and why they were in pain and wanting to learn more. And I actually founded InReach Online Physio with my partner, Chris Kennedy. And that was before the COVID pandemic. So quick disclaimer, talk to your physiotherapist or healthcare provider before implementing any of these recommendations that we give. All treatment plans should be individualized. So how today's going to go. We're going to give you an overview of the physical activity guidelines. This is how much physical exercise someone should be getting to prevent disease and live healthily. That includes kind of an equation where you have to take the amount of time you're exercising, but also take into account that intensity. Then we're going to break these guidelines down into each of the populations. Say disability, pregnancy is different than someone who's a child or an older adult. We're going to summarize, and then there's a really good video by Dr. Mike Evans at the end, if you're still with us, to do a good summary of everything. So these are the guidelines. So the last World Health Organization physical activity guidelines were in 2010. So it was time that they were updated. And so in late 2020, there was a group that got together to take all the research that had come out from the benefits and risks of exercise and put it together to suggest how much physical activity people should be getting and some other items that we'll talk about. And it's open access. So if you just Google that title, you'll be able to find it and read it in full, and the citations down at the bottom. Canada has their own physical activity guidelines as well. They were published and revised in 2018 by the Canadian Society for Exercise Physiology, and they separate their guidelines by age, so 0 to 4, 5 to 17, 18 to 64, and 65 plus. And then they also have specific guidelines for people with multiple sclerosis and pregnancy. So I'm going to give it all away right now, and then we're going to break down what these guidelines mean. So for adults, the new 2020 physical activity guidelines from the World Health Organization suggest that 150 to 300 minutes of moderate intensity exercise or 75 minutes to 150 minutes of vigorous intensity physical activity are suggested per week. For children and adolescents, they suggest 60 minutes per day of moderate to vigorous intensity aerobic physical activity across the week. And these are their suggestions to give you the best bang for your buck, to give you the best opportunity to get all the benefits from exercise, where the marginal benefit by doing more is not worth it, and by doing less, there's too much risk. They also stated, which is something a little bit new, that reducing sedentary behaviors is recommended across all age groups and abilities, although evidence was insufficient to quantify a sedentary behavior threshold. So they couldn't tell you how much sitting time is bad. So as I discussed, we need to take time and intensity to really understand what exercise is. So all the guidelines include a length of time and that intensity. So if you think of walking for 1 hour versus running for 30 minutes, do they equal? Are they the same? Or we definitely know that walking for 1 hour and running for 1 hour is different. So how do we determine the intensity? And the key thing here that I want to teach is everyone's lives are busy. And if you're going to use time in your day to go exercise, we want to ensure that you're doing it as efficiently and time effective and as possible to get that bang for your buck. And I really do think that a lot of people go out thinking that they're exercising and maybe they're doing the wrong intensity or they're not doing it for long enough. And so that's what I'm hoping I can help with today. Some of you may have seen this, the rating of perceived exertion scale. So it's a scale from 0 to 10, where 1 is a very light activity, more than sleeping, but like watching TV, where 10 is your max effort, very short burst of exercise or movement where you're out of breath, unable to talk, and you can only do it for, say, 10 seconds before you need to stop. So I try to make that a little bit simpler. Think of the number 1 to 3 being easy, numbers 4 to 6 being moderate, and then numbers 7 to 10 being vigorous. So split it into 3 categories. 1 to 3 is comfortably comfortable. You can do it pretty much for a very long amount of time, a nice slow walk, something that you really aren't feeling any burn in your muscle, anything like that. Moderate is uncomfortably comfortable, something you can do for a shorter period of time. You're getting a little bit of a burn in your muscles, but you know if you had to do it for, say, over an hour or even less than that, you would need to stop. And of course, these time amounts are different depending on everyone's age and their physical fitness. And then vigorous is 7 to 10. So that's uncomfortably uncomfortable, something that you can only do for a very short amount of time, as I said, and something that you need to stop to rest after. A nice little add-on here is the talk test. So if you're unable to hold a conversation, you know you're in that vigorous category, that 7 to 10 category. If you're just able to hold a conversation and you're taking a few breaths every once in a while to get some extra oxygen, then you know you're at that 6 range. So that's kind of the threshold between moderate to vigorous when we're looking at these guidelines. So if I go back, that spoiler might make a little bit more sense. So we're thinking 100 for adults, we're thinking 150 minutes to 300 minutes of moderate intensity exercise. So that's below that talk test. Whereas your other option is to collect 75 to 150 minutes of vigorous intensity above that talk test per week. So what else is new in the 2020 guidelines? There were specifics added on functional balance and strength training suggestions for older adults for them to build capacity and prevent falls, and we'll discuss this more later. They provided target ranges of activity time rather than minimum values. So research now shows that these ranges produce a maximum risk reduction for health issues, whereas before there was a threshold that people were being suggested to get past, and now these ranges are maybe a little bit more attainable. And the research shows, as I've mentioned, that increasing above that range does not show noticeable decrease in risk. As well, they now suggest that physical activity in any amount is associated with improved health outcomes, including all-cause mortality. So previously, they suggested that exercise needed to be done in bouts of greater than 10 minutes. And now they're saying that if you can accumulate that 150 to 300 minutes of moderate activity in any amount of repetitions or activities, bouts of activity throughout the week, that's great. And then a big one that's great to see is the recommendation for all individuals to reduce the time spent sedentary and not doing anything, or to increase the moderate to vigorous physical activity that they're doing to help offset that negative impact, or a combination of both. So some people have to sit at a desk for their job, but they're saying try to think of doing something to offset that, getting up and going for small walks that now, as you see in number 3, don't need to be greater than 10 minutes to have an effect. So let's discuss the specific population guidelines. So first categories are adults, which are 18 to 64 years. So as suggested and mentioned, adults should do at least 150 to 300 minutes of moderate intensity aerobic physical activity, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity for those health benefits. As well, they're including that muscle strengthening activities at moderate or greater intensity that include all muscle groups should be done 2 or more days a week for additional health benefits. And that would be things like joint health, osteoporosis, things like that. As well, adults should limit sedentary time, and replacing that time with physical activity of any intensity, including light, provides health benefits. So just trying to get us to keep moving. For children and adolescents should do an average of 60 minutes per day of moderate to vigorous intensity, mostly aerobic physical activity. As well, vigorous intensity aerobic activities that also strengthen muscles and bones should be included 3 times a week. So things like climbing on monkey bars, powerful movements like jumping, things like that for kids is going to be very beneficial in their development and keeping them fit. And then a nice one to see was that there are specific suggestions to limit sedentary time, particularly the amount of recreational screen time. So screens that are outside of school and just watching iPads and TV and things like that. For older adults, and I promise we'd come back to this, so the same guidelines, time guidelines and intensity guidelines for older adults apply as the regular adult category. And that's everything for activity and their sedentary guidelines. And so something to note is that older adults RPE is going to be different than adults. So that moderate is going to be a completely different activity for an older adult than it is an adult. As part of the weekly physical activity guidelines, older adults should do varied multi-component physical activity that emphasizes functional balance and strength training at moderate or greater intensity on 3+ days to enhance functional capacity and prevent falls. So this is new. They had enough research to have certainty that doing a balance program and a strength training program can prevent falls and keep older adults fit enough to have the capacity to do their activities of daily living. So something like this for balance could be practicing the stairs without the use of the railings when you're in a safe environment, you have maybe a spotter, or bouncing on one foot in the front of the kitchen sink. So recommendations for pregnant and postpartum women. The suggestion is that pregnant and postpartum women undertake regular physical activity throughout their pregnancy and postpartum period. And that's 150 minutes of moderate intensity aerobic physical activity throughout the week for substantial health benefits. There's suggestions to incorporate aerobic and muscle strengthening activities, and even evidence that shows that adding a gentle stretching program can be beneficial. A nice additional note is that the suggestion that women who before pregnancy habitually engaged in vigorous intensity aerobic activity or who were physically active can continue these activities during pregnancy and their postpartum period. So that's nice to see that they're not being told that they need to reduce the amount of physical activity they do, as long as their body was accustomed to it. Recommendations for people living with chronic conditions. So the conditions that were reviewed was cancer, hypertension, type 2 diabetes, and HIV. Physical activity is safe for adults living with those conditions without contraindications, and benefits generally outweigh the risks. So contraindications would be something that's in addition to the diagnosis of cancer, hypertension, that makes it unsafe for them to exercise. But if it's only the conditions that were reviewed, the benefits outweigh the risks. And there's high certainty that physical activity decreases cardiovascular disease mortality and risk factors associated with people with type 2 diabetes or hypertension. Number 3, there's high certainty evidence that shows that physical activity performed post-cancer diagnosis is related to lower risks of mortality from all causes. And as well, physical activity reduces the mortality risk in female breast cancer survivors and colorectal cancer survivors. Moderate certainty evidence for people living with HIV that physical activity enhances quality of life, increases their O2 consumption, exercise ability to tolerate exercise, their general health and physical functioning. And persons living with HIV are not adversely affected by physical activity. So they are saying that there's no additional risks. Moderate to high certainty evidence that physical activity decreases symptoms of anxiety and depression. Recommendations for people living with disabilities. So the disabilities that were reviewed was muscular sclerosis, spinal cord injury, intellectual disability, Parkinson's, stroke, major clinical depression, schizophrenia, and ADHD. And the main recommendation was to consult with a healthcare provider before determining the appropriate type of activity and the level to build from. And I would say this is appropriate for most of the other categories as well, but they wanted to make that statement clear. And number 2, physical activity is safe and beneficial for people with disabilities without those contraindications. High certainty evidence is available that physical activity can improve functioning in people with multiple sclerosis, spinal cord injury, and a history of stroke. And for people with schizophrenia and major clinical depression, there was moderate certainty evidence for beneficial effects on quality of life. So in summary, everyone will benefit from physical activity. And the key thing in 2020 is that some physical activity at any length and intensity is better than none. So accumulate those short bouts of activity if you can, when you can, and don't worry about not doing it, because something is better than nothing. And those little bits of activity will add up, and you don't necessarily need a full hour to do something. It could just be on a short 10-minute break or something like that. And this can be confusing, and a lot of people need help deciding where to start. And we're definitely available. So our job is to complete an assessment and to help you determine the appropriate type of activity. And that includes what you like to do and what you want to do and what you have access to. And then from that, determining the length and intensity that you should start with, and building you a program to increase that amount up to recommended amounts or even further. We have specialized physiotherapists in cancer, pelvic health, and chronic pain. So we can definitely try to work with your specific medical history. As this isn't a webinar that people are attending, you may have questions and comments. Feel free to email us or contact us on Instagram or Facebook. We would love to help answer your questions that you may have from this webinar. And a nice fun announcement. Our physiotherapist, Chris Kennedy, is starting small group exercise and education classes to help teach safe and effective strength exercise. And the classes are participants of 3, aged 45 or older, with or without knee or hip osteoarthritis. And they're going to be online sessions that are done over Zoom starting the first week of November. And they're 45 minutes, one time a week for 6 weeks. And the cost is that initial assessment, which will be your one-on-one appointment, which is $100, and then $33 per class. And that can be reimbursed by extended health coverage as well, which we direct bill. Some quick acknowledgements. The British Journal of Sports Medicine, who published this study, the Canadian Society for Exercise Physiology, who I mentioned, has their own guidelines. Dr. Mike Evans, who's the video I'm going to show next, and AMP Physio, which is an education platform. Enjoy this video.
I'm Dr. Mike Evans, and welcome to this visual lecture I'm calling 23 and a half hours. So I have a big interest in preventive medicine, which can mean a lot of things from, cancer screening to eating more fiber to having a good social network. And I mean that in the old sense of the word. Weighing less, drinking less, smoking less, controlling your blood pressure, cholesterol, and so on and so forth. So all these things are incredibly important, and I wouldn't want you to minimize your efforts in any one category. But I want to know what comes first. What has the biggest impact? What has the biggest return on investment? What makes the biggest difference to your health? So I did my research, and I found an answer, at least for me, and it's tricky because, all these things are sort of overlapping. But I picked out this intervention, and because of its breadth, it worked for so many different health problems, and that's what I found so cool about it. So just to kind of walk you through a quick list. So this intervention in patients with knee arthritis who receive 1 hour of treatment 3 times a week reduced their rates of pain and disability by 47%. In older patients, it reduced progression to dementia and Alzheimer's by around 50%. For patients at high risk of diabetes and coupled with other lifestyle interventions, it reduced progression to frank diabetes by 58%. Postmenopausal woman who had 4 hours a week of the treatment had a 41% reduction in the risk of hip fracture. It reduced anxiety by 48% in a big meta-analysis. Patients suffering from depression, 30% were relieved with low dose, and that bumped to 47% as we increased the dose. Following over 10,000 Harvard alumni for over 12 years, those that had the intervention had a 23% lower risk of death than those who didn't get the treatment. It's the number one treatment of fatigue. And of course, the kind of outcome of choice there, my favorite outcome is quality of life, which is really all of the above and really about making your life better. And this treatment has been shown over and over again to improve quality of life. So the question is, what's the medicine and what is 23 and a half hours? So the medicine was exercise, mostly walking, so not triathlons. And let me just put it a different way. I think what I'm asking you to do is, if you think about your typical day, so there's 24 hours, and so you might spend most of your day, this varies obviously, but couch surfing, sitting at work, obviously sleeping. And what the evidence that I'm going to show you kind of tells me is the best thing you can do for your health is to spend half an hour being active, maybe an hour. And that if you can do that, you can realize all the benefits I described in the previous slides. So let's just take a quick walk through some of the literature. So Stephen Blair, he's a professor at the Arnold School of Public Health at the University of South Carolina, and he looked at this in what's called the aerobic center longitudinal study, which followed over 50,000 men and women over time. And along the left side of this graph is something called attributable fractions, which is a kind of fancy word, but it's the estimate of the number of deaths in a population that would have been avoided if that specific risk factor had been erased. So for example, turning a smoker into a non-smoker or a couch potato into a daily walker. And along the bottom is the typical risk factors. You can see the hypertension is incredibly important and so on and so forth. But the one that kind of applied the most risk was this sort of mysterious CRF, which is cardiorespiratory fitness, which is really low fitness. So low fitness was the strongest predictor of death. And this is important. That most of the trials we see, to be honest, are funded by pharma or other companies because they've got a drug for hypertension or high cholesterol or diabetes. And we rarely see fitness thrown into the mix. And so it's nice to see a trial that's not so siloed. Blair's work is interesting. He also did another trial looking at obesity, what he found was, sort of two things. One is obesity and no exercise. That's a very bad combination. And that's where we saw many of the negative consequences of obesity from a health point of view. But if the obese person was active, even if they didn't have the weight loss, but were just active and obese, that was much, much better. And that the exercise ameliorated much of the negative consequences of obesity. So if exercise is a medicine, what's a dose? So when I think of dose, I think of how long, how often, and how intense. I'm going to give you a slightly mixed message, but essentially more activity is better. But I must say the rate of return seems to decline after 20 or 30 minutes a day. So if you're being active less than 150 minutes a week, or more if you're a kid, an hour a day if you're a kid, my flag goes up in the clinic. So my personal take on this is that the literature draws a very broad brush. And so we see big differences when somebody goes from not doing anything to doing something. And after that, the return is more granular. So if we took the Nurses' Health Study, women who went from zero activity to just 1 hour a week reduced their heart disease rates by almost half. So you can break it down. So it can be 10 minutes, 10 minutes, 10 minutes if you want to do 30 minutes of exercise. So it can be broken into 3. Higher intensity, it looks like it's equivalent to less time with lower intensity. But I think obviously the clinical pearl is mostly thinking about your style and habits and your personal cues. So if you're only going to do it if it's pre-booked with friends, I have couples that take a half-hour walk every morning or evening to organize their life. A dog is a great walking coach. The data is showing 67% of dog walkers achieve the 150 minutes a week just with the dog walking. And finally, of course, your commute, getting off stop early, taking the stairs, and so on and so forth. So thinking about that, I'm just going to walk you through some quick slices of the literature. The first one comes from Japan. In the 90s, Japan required all employers to conduct annual health screens for their employees. And so a large gas company in Japan called Osaka used this to answer a great question. So if people's walk to work was longer, did that reduce their chance of serious health problems? So in this example, high blood pressure. And what they found is under 10-minute walk, no difference. 11 to 20-minute walk, 12% reduction in rates of high blood pressure or hypertension. And over 21-minute walk, a 29% decrease in rates of high blood pressure. So the authors calculated that for every increase of 10 minutes in your walk to work, there was a 12% reduction in the likelihood of getting high blood pressure. The second exhibit is looking at stents. So this is something we commonly do down medicine. So you can see on the left here, the artery's blocked. On the right, a vascular surgeon's gone in and put in a balloon, opened it up and left a stent to keep it open, which makes great sense. So a German researcher named Rainer Hambrecht looked at this with about 100 cardiac patients. He got half the group to exercise, and by that I mean 20 minutes a day on an exercise bicycle, and then once weekly 60-minute aerobics class. And the other half got the high-tech stent and just sort of normal activity. And after 1 year, 88% of the exercises were event-free compared to 70% of the people that got a stent. So both worked, but I find it sort of incredible that the low tech made a bigger difference. And you have to remember that the stent just fixes one part of the heart. The next way to think about it is the reverse. So what I call sitting disease. We know that being sedentary is bad for your health, but a researcher named Leonard Veerman wanted to quantify this, and he did so down in Australia in a big study they did there. They found, compared with persons who watch no TV, those that spend a lifetime average of 6 hours a day watching TV can expect to live about 5 years left. I mean, that's incredible. But then I think, who watches 6 hours a day of TV? And it turns out the average adult in the USA spends about 5 hours a day watching TV or screens. So I find this fascinating that we never think of the TV as something that's bad for our health, but clearly it's as powerful as many other risk factors for chronic disease. So I'm just going to leave you with, I guess, 2 quotes. So one is Jerry Garcia, the singer who is the lead singer for the Grateful Dead. And he said, somebody has to do something. It's just incredibly pathetic that has to be us. And I think that's true, that in some ways it has to be us. As Hippocrates said, walking is man's best medicine. And so I'm going to finish by asking you a question. And this may have some personal challenges for you. So, you might be very busy with work or kids or both, and you may be in pain or have other priorities. But my question to you is, can you limit your sitting and sleeping to just 23 and a half hours a day? So something to think about. Thank you very much.